And a good segue to our next one, because we started talking about gut infections, and one of the most common ones we see is H. pylori. So, Mary on Instagram, her question is, I have H. pylori and acid reflux. What sort of diet and supplement should I take to get rid of this?
Yeah, this is really good. H. pylori is a very, very common infection. It lives in the stomach. So most of the microbiome is not in the stomach, right? It's in the small intestine and the large intestine, particularly the large intestine. H. pylori is one of the very few, I think it's really the only that I know of that loves the stomach environment. Okay. And so it gets into the stomach and it releases an enzyme called urease that binds with our hydrochloric acid and creates ammonia and lowers or I should say, it actually raises the pH, lowers the acidity in the stomach, raises the pH in the stomach, and creates an environment that it can really survive and thrive in. And it burrows. It's kind of a spiral rod shaped bacteria, and it loves to burrow in the mucosa in the stomach, where it releases enzymes that actually degrade the mucosal lining in the stomach. And that's how, the stomach is able to survive. It has to produce a lot of acid. In fact, in order to digest a steak, for example, it needs the pH needs to be around 1.5 to 2.2, which is very, very acidic. If you got that on your skin, it would burn your skin. The reason why it doesn't burn the stomach is because we have this very thick mucus layer in the stomach that protects it. But H. pylori starts to degrade the stomach lining, and neutralizes the pH. So it brings the pH, doesn't allow the pH to get that acidic. And that's super important because you need that in order to sterilize your food, in order to break down protein, in order to break down and absorb minerals, vitamin B12, right? So people that have chronic low stomach acid levels, not enough stomach, often end up with protein deficiencies because they can't break down the protein into amino acids effectively. They end up with zinc deficiencies, iron, oftentimes anemia, not always, but sometimes calcium, magnesium deficiencies. They can develop vitamin B12 deficiencies. So a lot of different problems there. And H. pylori also it's a gram-negative bacteria, and that means it has two cell membranes, and it will release one of those cell membranes when it dies off. And that cell membrane, it's actually called a lipopolysaccharide, which is a really potent inflammatory mediator. So it really drives up inflammation when we have overgrowth of H. pylori, just drives up whole body inflammation. And it's, one of the major reasons why, it's not the only cause of acid reflux, but it is a significant contributor of acid reflux. And the reason why is because you need a very acidic bolus. A bolus means basically pre-digested food in your stomach in order to open up the pyloric sphincter to move food from the stomach into the small intestine. When you don't get the pH of the stomach acid low enough, so you don't get enough acid in there, food just sits in the gut, and it will start to basically break down, putrefy, create gas, and that gas will put a pressure up on the esophageal sphincter and open it. And now this acid that, we have this thick mucus lining, so we don't feel it in our stomach. We don't have that in our esophagus. So now that acid jumps up into the esophagus, burns the esophagus, and we get that acid reflux. And so it's a major contributor to that. So H. pylori it's a really big issue if it's overgrown in your system. All of us have it. It's a commensal bacteria. So we all have it. However, when it overgrows, now it's going to cause a lot of different problems.
Right. And so for diet, especially if she's complaining about acid reflux, then I would usually recommend avoiding things like spicy and acidic foods. So tomatoes, even citrus fruits can be problematic for some people. Fried foods can be very irritating. So the goal is to heal the gut. So this is causing issues in the gut. A lot of times people will have pain or distension, bloating. Bad breath is a common symptom with H. pylori, and of course the reflux. So want to do foods that are very soothing to the gut, like cooked vegetables, soups, bone broth, things like that. So that's what I usually recommend with diet. And then with protocol, we have a really great protocol that we use, which includes a antimicrobial blend called GI Clear. And then we use another blend called Gastro Soothe that has zinc carnosine and mastic gum and other compounds that are very soothing and healing. And then several other products from Microbiome Labs, like the PyloGuard. And then MegaGuard is another. We don't have to use all of these things. We individualize all of our protocols depending on the person. These are just some of the products that we have found to be helpful because, like we said, we've seen H. pylori on many of the stool tests we run. The GI map is one of the most common tests we run. It's a stool analysis, and one of the bacteria that's measured on the GI map is H. pylori. So we do see it frequently. So we have lots of tools in our toolbox. We do diet, we do gut healing, and then we also have products that help too. So that's how we approach H. pylori.
Yeah, for sure. And I'm glad that you mentioned the bad breath. That is a common symptom. And that's because, again, the ammonia that's produced. So ammonia is coming out of the breath. So oftentimes people will notice bad breath, belching, burping after meals, oftentimes common. Sometimes constipation for a lot of people can be a factor with H. pylori overgrowth as well. Sometimes skin issues, rosacea. There's a lot of links between H. pylori overgrowth and rosacea. So it's kind of like the reddening of the cheeks, and acne can also be a factor as well, skin rashes. And then there's a lot of links in the literature between H. pylori and autoimmune thyroid disorders, Hashimoto's thyroiditis, which is an autoimmune disorder that causes low thyroid, and then also Graves' hyperthyroidism. A lot of linkage there between H. pylori overgrowth and autoimmune thyroid disorders. So if you're dealing with any of those, definitely good to get H. pylori looked at. Our team, we're experts at looking at a couple different labs. We can actually see markers and patterns for H. pylori off of blood analysis. And then also we can do more specific testing like a stool analysis so we can just look at a comprehensive blood analysis and understand if you're at a higher risk for H. pylori based on looking at markers like, for example, your zinc, your globulin levels, your protein, total protein, right? A lot of different markers like that. There's a certain pattern for H. pylori. And then we also will do a stool analysis that will actually look at H. pylori as well, called the GI map. And it will also look at how virulent the H. pylori is, because the H. pylori is releasing a lot of different endotoxins. Some of those endotoxins are more damaging and create more inflammatory reactions than others. So if your virulence factors are elevated, you're at a higher risk for developing an ulcer or developing perhaps even gastric cancer. H. pylori is the number one causative factor for stomach cancer. So we can actually look at that years and, before you actually get a diagnosis and be able to address it. So really important if you're dealing with any of these symptoms that you're getting this sort of testing. And you mentioned this supplement called PyloGuard, which has a certain type of bacteria, that probiotic bacteria that helps to neutralize H. pylori, which is really interesting. And so that can be really helpful. And then you mentioned some other herbs. Aloe vera, very good for helping to soothe the stomach and create an environment that H. pylori doesn't like. Marshmallow root extract, slippery elm can be helpful. Mastic gum, which is kind of like this kind of sticky gum that can get into the stomach and help basically pull H. pylori out of there. That can be really helpful. Licorice root extract, really good for again, building up that stomach mucosa and helping reduce H. pylori. So that can be really, really helpful. I typically will have people drink things like ginger tea. That can be helpful. Licorice root. There's a lot of different herbal teas that have licorice root, chamomile as well. All very soothing on the stomach and help provide a good environment to help your body naturally reduce H. pylori levels. Now, H. pylori can be tough though. And one of the reasons why is that it has these efflux pumps, and these efflux pumps allow it to kind of like, so if the antibiotic gets into its system, it allows it to kind of kick it out. And H. pylori is a common one that will develop antibiotic resistance. A lot of times in the medical world, they see H. pylori, they give you an antibiotic. Okay. But it can very much create an antibiotic resistance. And this is why the gold standard in the medical world is a triple therapy of probiotics. They use 3 different antibiotics, right, in order to bring H. pylori down. The good thing is when you do herbs, okay, there's a lot, when you do a blend of herbs, there's a lot lower chance of developing a resistance because we're coming at it from a multitude of different mechanisms, right? With different herbs and how they interact with H. pylori. And that's why we love the herbal approach, because it's a lot harder for H. pylori to develop any sort of resistance, because then again, we're coming at it with a whole blend of different herbal constituents, and the active compounds and ingredients. It's really hard for H. pylori to adapt to those, and that's why they can be so effective. And I found them to be even more effective than antibiotics when it comes to H. pylori. So there's different ways of going about it, but it's definitely something you want to get looked at, addressed, and tested for without a doubt.